In this morning's Health Watch, is your New Year's resolution to lead a healthier life? Me too. We're not alone. I know. It's a very common one. A recent survey finds one of the most common resolutions is to be healthier in 2026, from exercising more to improving your mental health. And if you need tips on how to get started, you are in luck because our chief medical correspondent, Dr. Jon LaPook, is here with everything you need to know for your health checklist. Dr. LaPook, welcome.
Morning. Great to be here.
Oh, it's so cheerful to have you here, Dr. LaPook. So what is the first thing people should do when they want to think about being healthier for the next year?
I always think about, like, who's your healthcare team? And I have to acknowledge, right, there are 27 million Americans who don't have insurance, and that number's going to go up if the subsidies are allowed to expire. But assume you're lucky enough to have insurance. Who is the primary care person? You know, who's the captain of the ship, the point person? I think it's really hard to find that person these days, but that's the person who you're going to sort of go to. And then after that, there's another team, right? If you're a woman, gynecologist, is that gynecologist also playing the role of primary care person? And if so, then they have to be checking your cholesterol and your blood sugar and things like that. So, you know, often there's different roles. Do you need an eye doctor, a skin doctor? And that depends on your risk factors and things like that. So I think assembling the team first, and then understanding, like, you have a role, a responsibility to do your homework before you go in. So don't go in and they say, well, what pills do you take? I'm taking the little white pill. We don't know what the know what the pill.
Has anyone ever said that to us?
Yes. I don't know the little white
His
pill.
name is Vlad.
Yeah.
Because, no, you say it's important that people make sure that their primary care doctor is the right one for them. That's why Dr. LaPook is my doctor, because I think bedside manner is incredibly important. I know that you may have a world-class doctor at your disposal, but if the bedside manner, I'm not feeling it, it's not right for me.
Yeah, you're talking my language. Of course, I started the Empathy Project at NYU Langone. I'm a professor of medicine, and the idea is to use Hollywood-quality short films to teach clinicians in training to be more empathic and sensitive and competent, and then empower patients to demand that. And I think people should be empowered to fire their healthcare provider if they're not getting the kind of care and communication they need. I mean, there's a thing called engaged curiosity with empathy. That's a core thing. You know, it's like, is the person leaning in? Are they really listening? When the clinician is in the room, are they really in the room? And I think that's just so important for people to feel that, you know, they deserve that.
Well, I've also heard you say that it's really important to do a mental health screening. But to that point, I feel like it's hard to answer those questions very honestly if you don't have that empathy that you're receiving. So talk to me how about that process should go.
And you know, there are these depression tests that you can give and things. I think nothing beats a relationship, right? And that's why it's so important to really have a healthcare provider who you know. I mean, I'll give you a small example, right? So I'm an internist and a gastroenterologist. And about 3 years ago, a woman who I've known for 30 years came into my office and she said, "Hi." I said, "What's the matter?" And she burst into tears. And when she stopped crying, she said, "How did you know?" I said, "It was too big of a high." So, I mean, that was obvious. I worry, you know, what am I missing? What more subtle pieces of body language and tone do I miss? And I think you have to really know somebody. It's not just a matter of a walk-in clinic where you see the person, never see them again. You need to have that relationship.
And what's the current mental health of a lot of patients that you're seeing? And what's your advice for people who want to do better and try to work on that for the new year?
I am finding that people are coming into my internal medicine practice sort of like this in the past year, right? And you have to give yourself grace and realize, look, we've been through a pandemic. We may not want to think about it, but I think a lot of us have a degree of PTSD from it. In addition, there's stuff going on in the world, no matter what side of the political spectrum you are, that makes you like this. And I'm telling people, you know, it's tough, right? You want to help everybody. You want to worry about other people in the world, but don't be also embarrassed to sort of create a little silo. It's okay for you to enjoy your own life, but to make sure you have social connection. Because especially during the pandemic, we kind of lost that. There's nothing better for your mental health than social connection, for being with people, and also for having the vulnerability. Don't be afraid to say, look, I'm simply not doing well. Communicate.
I love that. One other thing I love is we've had you in studio all week. You're coming back tomorrow, and tomorrow's kind of a humdinger.
Yeah, humdinger. Okay, so we have a piece this Sunday on The Pit, and we interviewed Noah.
The TV show from HBO.
Right, and it's going to debut on the 8th. And on the 4th, on Sunday morning, we're going to have a piece about it. And Noah Wiley, he is just another level of empathy. I mean, he's all about that. And to me, the show is about empathy because you've seen things on TV about, of course, we have to have empathy for our patients. He's also talking about having empathy for each other as healthcare providers. We're getting burned out, and having empathy for yourself. So I know when I teach people with the Empathy Project, teach the medical students, look, there's always got to be a wall between yourself and the patient, right? You don't want to make it too thick because you miss out on the good stuff. You don't want to make it too thin and porous because you get nailed emotionally. And we're always sculpting that wall. I always say, you know, if you have to err on one side, err on the wall of make it too thin and porous.
I can't wait for this story tomorrow.
I hope you make a cameo in next season.
As he'll play Dr. LaPook.
You'll play Dr. LaPook. Dr. LaPook, we thank you very much.